Now, healthcare. Dr. Rajapandian, CEO, Sheela and Bethel Hospital. Respected orthopedic surgeon trained at CMC Vellore, Stanley Medical College, and Kilpauk Medical College. Dr. Rajapandian has treated patients in several leading hospitals across Coimbatore, Tiruppur, and the Nilgiris. For nearly 2 decades, he taught and practiced at Coimbatore Medical College Hospital, inspiring generations of doctors with his clinical expertise and humble spirits. His calling was never just to operate, but to serve. I would like to invite Dr. Rajapandian to deliver his speech and share his insights with us.
Good evening to the dignitaries on the dais and friends. Mr. Shantakumar asked me to talk about the health industry and GST. As an orthopedic surgeon, I know better how to treat a broken bone or a joint which is worn out than knowing about the GST. That's what I was telling Mr. Manimohan, how bad we are. Of course, but anyway, we are not very illiterate like Mr. Shantakumar said. We are little knew about the GST and other taxes as well. Health is a very important part of any human being. There is a proverb that health is wealth. See, if you don't have a good health, whatever position you hold or however rich you are, it's of no use. You cannot enjoy anything in life. So wherever I go and speak, I tell everybody to take care of your health first, then the tax next. So all of you should take care of your health. So a person who is lying on the pavement, a homeless, to a billionaire, anybody can fall sick at any time. A person who cannot afford treatment in a private hospital can at any time go to a government hospital, and nowadays whatever the private sector has got, the government hospitals have also got the facilities to any type of illness, where the whole treatment is free for the person, including the inpatient treatment, medications, surgery, whatever it may be. Whereas when a person comes to treatment in a private hospital, he has to pay for everything. But one good aspect is that there is no GST for the health sector. For all the services we do, we don't collect any GST from the patients, except in a certain service like where there is a multi-speciality hospital where the ICU charges more than 50,000 rupees. Probably we may have to collect the GST, and of course that can be reversed. In the medicines, in the pharmacy, there are two types. One, the pharmacy is a different one, and another sector, the hospital buys the medicine and dispenses to the patients. When you buy medicine from the pharmacy as an outpatient, the GST is charged, but the input credit can be taken. So thereby, the one way it is good to the government as well to the patient also. But only thing is the tax slab was very different earlier, even after the GST when it came into force in 2017. The slab rates for different types of medicines were different. For example, for cancer drugs, medicines used to treat cancer patients as well, there are certain drugs which were charged zero. There was no GST. But basically, it was 5%, 12%, and 18%. But most of the medicines what we use for the patients was in the slab rate of 12% till some time ago. Now it is on a flat rate of 5%. this is of immense help to the patients. They save a lot of money. The patients, see, so for example, 7% of benefit. Earlier they were paying 12%, now they are paying only 5%. And so the GST, the health industry doesn't have much problems related to GST because the instruments what the hospital buys to treat the patients, that we have to pay the GST, but we cannot take the input credit. So that of course we have to write as the expenses when it comes to the income tax. Only in pharmacy, medicine, we get the GST from the patient and then we pay to the government. So there is not much issues related to GST in the health sector. And out of this, I would like to, having been asked to come here for this forum, I would like to say one thing regarding the insurance. Now the awareness is picked up quite a bit in the urban areas, but not in the rural. A lot of people still don't take this insurance, health insurance. So if you tell them, they'll say, I will not have any illness. எனக்கு எந்த நோயும் வராது, இதில் செலவழிக்கிறதெல்லாம் வேஸ்ட் அப்படிம்பாங்க. But it's not like that. See, when you fall sick suddenly, for example, now the traffic is in chaos. See, any accident can happen to anybody, even though we are very careful. And lifestyle diseases like diabetes, heart problems, and because of the stress, working stress, and people get so many illness. So when you want to treat it, then you need money. At that time, you cannot run here and there to mobilize funds, especially in the middle class and lower middle class people. They will find it difficult to raise funds when suddenly something bad happens. So all of us should take health insurance, and we have to motivate our friends and relatives also to have health insurance. For example, if you pay about 20,000 rupees per month, you are covered for 20 lakhs. You can't say it's a waste. See, we are spending so much on so many things. We are drinking coffee for a price of 35 rupees. Airport, it is 75 rupees. When you spend on that, why can't this 20,000 rupees per year? So that is one thing I would like to impress upon all our friends to do that. I thank Mr. Shantakumar and Indian Taxpayer Forum for giving me this opportunity to be here with you all. Once again, thank you very much.